Hello. Okay. Another negative thing I see that's not helpful to a case um, is statements made by a claimant. It could be in the doctor's office. It could be on a function report. Um, it could be at a hearing. Hopefully this wouldn't happen at a hearing. Hopefully you have legal counsel that would explain to you. But when you are discussing your pain, let's say you're in the doctor's office and they have a pain chart and you say it's 10 out of 10, but you drove yourself to that appointment. You've walked in the door, you sat in the waiting room, and you walked into the examining room. You changed your clothes. If you had to get no gown or what have you, got on the table. 10 out of 10 pain is, I believe it's considered like the worst of the worst. You can't get higher. I think there's a perception that if you have 10 out of 10 pain, you're actually going to the ER. You probably can't drive there. You probably have to take an ambulance. So talking about 10 out of 10 pain while you're still able to hold a conversation, drive to the appointment, or someone drove you perhaps, but you're walking in without, say, a wheelchair, without cringing, without expressions of pain. It just doesn't seem to be consistent with what would be 10-10 pain. So the difficulty of putting in 10-10 pain when you're actually functioning is that it's probably going to lose some credibility. And therefore, you are going to lose credibility. And if you lose credibility there, your entire case can be lacking in credibility. It's just human nature to look at it that way. 9-10 pain. I don't know how low it would go and still be considered a little maybe inconsistent with what you're actually doing. Yeah, 7-8, maybe that's too high. Not sure. I'm just really talking about the 10s and maybe the 9s for sure. But I mean, I think a 5 is pretty bad if you have to live with it, for goodness sake. A 4 or 5, living with it chronically is going to really wear you down. You don't have to claim to have a 10 for people to understand that you have a pain problem. So I think just take that at heed. Be careful what you say. Don't speak loosely. Be cognizant of what you're saying and how it can be perceived, because credibility is such an important factor in our cases, in your case. So inadvertently blowing it by just speaking off the cuff like that. I'll say that could also probably be true when someone is talking about migraines and they drove 25 minutes to the doctor's office and they said, I have a migraine, like right now. The difference between migraines and headaches are really important. It's a difficult area and impairment to begin with Social Security disability, although it is recognized, it's difficult. So we work really hard to always build the crumbs to build the cake of how bad the migraines are. And driving to a doctor's office would probably be considered inconsistent to someone actually suffering a migraine. Could you have a dull headache? For sure. Probably not knives in your head, not with driving, not with the lights. So when you claim to have a migraine while you just, are functioning for 2 hours outside of the house, it might be a credibility killer. If it's a headache, by all means, share that you have the headache. But to claim it's a migraine might be a little troublesome. If you have some sort of weird migraine that is not so invasive, maybe, but then why is it a migraine? And don't get me wrong, that's something you would talk to about your doctor, of course, right? There's headache diagnoses and there's migraine diagnoses. And sometimes it's a headache that is the result of something else, say a musculoskeletal issue that causes a headache. It could be, it's very complicated. But just going back to it, describing a headache as a migraine in the middle of chatting your head off, driving to the office, stopping at the grocery store on the way in, or mention it to your doctor, and then I got to go to the dry cleaners on the way out of here, but I have a really bad migraine. It's gonna take the steam out of your sails, I think, on your case. So loose lips, sloppy speaking. I know we all speak with a certain vernacular, and you're used to describing it as a migraine because you have them. But be careful not to inadvertently confuse a headache with a migraine when you're speaking to your doctor. Because I have a feeling the doctors might be internally rolling their eyes, realizing that this is not a migraine. And again, it's credibility, and the judge or the decision maker is going to see that. So just try to be careful and more accurate in the way you describe yourself to your providers. Okay, thanks.